Services that are family-centred recognise that children learn and develop within the context of the family. Therefore, there is a need to understand the family's resources and support networks and build on their strengths. When we first meet a family, we need to know the answers to questions like who provides informal support to the family and what services are they currently involved with. However, often we only gather small pieces of the information that we need. For example, on this form we can see the allied health services that the family are involved with, but it doesn't show who, besides the service, offers this family's support. One tool that can be useful for gathering information about family support networks is an Ecomap. Ecomaps are a visual representation of the family's formal and informal support networks. An ecomap is different from a genogram. A genogram leads to an understanding of the family structure, whereas an ecomap looks at sources of support from both inside and outside the family network. Through the development of an ecomap, we can understand the links between the family and their support network. We are able to see not only who provides support, but also what that support looks like. In particular, we can identify who within the family support network provide strong positive support, moderate support, or a weaker level of support. We can also see where there are stressful relationships. Ecomaps were first used back in 1975 by a social worker called Anne Hartman. They are now regularly used in early childhood intervention, particularly in a model called Routines-Based Early Intervention, developed by Robin McWilliam. Ecomaps are useful for many reasons. The development of an ecomap at the commencement of services provides opportunity to start developing a positive relationship with a family. Ecomap development helps to communicate that the service wants to understand and support the whole family, not just the child. It can help show that a service is truly family-centred. As already mentioned, ecomaps provide an understanding of the informal supports a family has, and the formal services that they are already involved with. Strategies to support a child's development can then be discussed with reference to how key people can be included. The need for collaboration between services can also be identified and discussed. Ecomaps are easy to complete. You just need a sheet of A3 paper and a pen. Larger paper sizes are always better, as it means you can expand your map freely as and when you need to. Some people like to use different coloured pens when drawing the ecomap. Before you start, explain to the family members involved what the purpose of the ecomap is. One way to introduce the ecomap could be by saying,
"We want to get to know your family and the supports you have around you. We can then see if we can use some of these supports to help you meet your goals. Having an understanding of the services you're involved with also means that we can make sure that we're all working together right from the start."
There are a couple of other important pieces of information to tell the family prior to starting to draw their ecomap.
Now, Emily, whatever you tell me is up to you. It's completely voluntary. You'll also get a copy of your ecomap so you can share it with other services if you want.
Make sure you also let them know where their ecomap will be stored and who will have access to it. In this section, we'll be covering questions that clinicians can use when developing an ecomap and some examples of family responses. If possible, sit next to the parent so they can see the paper. Start by asking the question,
Emily, who lives in the house with you?
Well, there's me and my partner James and Chloe, our daughter.
And how old is Chloe?
Chloe is now 24 months old.
We don't ask the age of the parents. Draw a square around all the people in the house. We then ask about the family's informal network. This usually starts with the extended family, but could be anyone who the family would like to be included on their ecomap. Informal supports are put at the top of the page, above the family.
Thinking about your extended family and the support that they provide you, who would you like to include on your Ecomap?
Well, there's Chris, my father,
And how often do you see him?
about once a week.
And how does he like to support you?
James gets on really well with him and they do things together. He will also babysit Chloe if no one else can, but he's a bit of a last option.
So what does he like doing with Chloe?
He likes to take her out in the pram to the park.
These questions are asked in order to get an understanding of the support offered or stress caused by the relationship. Let's illustrate Mum's relationship with Chris as a weaker relationship. For each person or persons discussed, draw a circle around them. Families may cluster groups of people together. Draw lines from the central square to the various supports during the conversation. Lines of different widths can be used to represent the supportiveness of the relationship, with thinner lines representing weaker support and thicker lines representing a strong relationship. Dotted lines can be used to represent a stressful relationship. Although the lines support interpretation of the drawing, it's important to remember that the conversation does not have to focus on the lines. This is not the sole purpose of drawing an Ecomap, and some families have requested not to have lines drawn at all. The overall conversation is the important thing. It's also possible for a person to provide support and cause stress at the same time. If this is the case, the lines are drawn next to each other. For example, a grandparent may be willing to babysit the child and provide support, but may also make the parents feel guilty that they are not looking after the child themselves. A stressful relationship may also exist when a parent's ideas about raising the child differ from those of the grandparents. This process is repeated for all the informal supports the family want to include. Following the conversation about family, ask questions about the supports available to the family in their neighbourhood, through their work, sporting groups, and religious communities. These are added to the Ecomap along the side of the family square. It can be useful to ask,
If you have something you need to do urgently, who would you call on for support? Would you ask this person for support if you needed it?
asking about informal supports is then followed by asking about the formal services that the family are involved with. This could include mainstream services such as their GP, childcare or school, as well as specialist services such as allied health staff and their respective organisations. Questions to ask about these formal supports include:
How often do you see them? Where do you see them? What support do they provide? How often does the child attend?
The way the family describes these services will help determine the width of the line to connect to it.
I take Chloe to childcare 2 days a week, and Angela, the childcare worker there, is very supportive. I go in and see her each time, and she never rushes me. I take Chloe to our GP when she is sick. I trust the GP's medical advice, but he's not very helpful with how to help with Chloe's language delay.
If time allows, it can be beneficial to ask about what the family likes doing together, as well as what they feel their strengths are. Once the Ecomap has been drawn, show it to the family and ask the following questions.
Okay, Emily, now that you've had a look at your Ecomap, is there anyone missing that you'd like to add? What do you notice when you look at your Ecomap? When looking at your Ecomap, is there anything you would like to change or look different?
If the answer to this question is yes, ask,
What would you like to change?
be sensitive so that you are not perceived as intrusive. Remember that the information gathered for an Ecomap is quite personal, and it should only be gathered if it is going to be used for one of the following reasons: to promote teamwork and collaboration with others, to identify who might be able to support the family with implementing strategies, and to help identify the need for further support or resources that may be useful to the family. We are now going to have a look at some completed ecomaps and see what we can learn about the families they relate to. This ecomap illustrates a family where the mother is a single parent. Notice the lack of strong informal supports. Most of the family's informal supports are related to contacts made through services that support the child with delayed development. The only strong supportive relationship that the mother has is the professional relationship with her psychologist. The mother's relationship with her own mother is supportive but stressful. The child often spends weekends with his grandmother, but the mother and grandmother disagree about the way to parent properly. This ecomap illustrates a family that accesses a large number of formal supports. Notice the imbalance between the number of informal and formal supports. Although there are multiple formal supports, the mother has not described them as being strongly supportive. The mother describes the relationship with the service where the child spends a few days a week as stressful. Consider what the impact may be of the limited supports going to the other sibling. This is an ecomap for an Aboriginal family. The child spends equal amounts of time with the mother and the maternal grandmother. Therefore, additional questions were asked about the people in that house as well, and details were added to the ecomap as requested. The mother describes her extended family as brothers and sisters that take on a parenting role with her child. The mother also identified that there are times when the extended family move into her house for indefinite periods of time. As can be seen from the examples, ecomaps are a useful tool in capturing an overall picture of the family and their supports. In summary, ecomaps capture the informal and formal supports that a family has available to them at a particular point in time, and illustrates the strength of the relationships provided by these supports. They should be reviewed and updated regularly. Ecomaps should not just be filed away once completed. The information gathered in an ecomap should be used in collaboration with the family and other team members to plan and implement intervention in a way that considers the needs and context of the family as a whole.